welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Michael Foti and Tushar Bhagat. Thanks for joining us today, Michael and Tushar.
Thanks for having us, Kim.
Thank you, Kim.
You're very welcome. So I usually start by saying how we met, and Michael reached out to me on LinkedIn, sharing that we're both advocates for physician wellness. And Tushar also reached out saying he found me on one of Dr. Jonathan Fisher's posts. And you also mentioned that we're committed towards the same goal, well-being for others, especially for the physician. So that's something that all three of us are extremely passionate about. And you also added being in a cancer research career that you commented on my cancer journey. And by way of more formal introduction, Michael is a clinical assistant professor of internal medicine at Touro College and the author of Grief, A Doctor's Battle with Anxiety and Depression. Michael describes himself as a motivated medical educator, passionate about raising awareness regarding mental health in the medical community. He's received overwhelmingly positive feedback from his articles and talks sharing his struggles with mental health, and he's appeared on podcasts including AMA's Step Forward, and I listened to that and it was very well done. And I'm so glad that you could be here to talk about. We know that it's very important to shed light on these issues and to be comfortable in talking about them. So thanks in advance.
Thank you, Kim.
And Tushar teaches mindfulness-based stress reduction programs at the Albert Einstein College of Medicine and Cancer Research Institute to cancer patients, students, medical residents, doctors, therapists, scientists, and staff. As an assistant professor in the Department of Oncology, he also conducts translational cancer research. That's a lot of work, Tushar. You're a busy guy. So today we'll discuss each of your journeys to becoming advocates for physician well-being. And Michael, I want to make sure that we touch on your Cafe Foti because I think that's really cool and really important. So as we get started, I always ask what you'd like our audience most to know about you. Michael, would you like to go first?
Sure. Yeah, I mean, you summed it up very well, but I am very much a passionate advocate for mental health, especially among the health workforce. And if I may explain why, so this really goes back to the first wave of the COVID-19 pandemic that began, and as everyone knows, the spring of 2020. And at that time, I was an intern or first year resident in my internal medicine residency at Greenwich, Connecticut. And it was just a very chaotic and dark time of my life. There were, these were 12, 16-hour days, seeing suffering and death on a daily basis. And what made it even more difficult is these patients were young. These were patients in their 30s and 40s, close to my age, who were dying and suffering from this disease. And it was very difficult, and this carried on for a while. As everyone knows, we're just getting out of the pandemic now. Around the same time, unfortunately, my mother passed away from what we found out to be undiagnosed stage 4 lung cancer. And she passed away pretty suddenly within 2 weeks of us finding this out. And so it was a very dark time for me. And once I graduated residency is when my mental health journey really began and when I manifested a lot of the symptoms of my panic disorder and depression. I had a very intense chest pain every night, felt like someone was squeezing my arm, very similar symptoms to what would someone describe as a heart attack, honestly. And then every day waking up with an intense fluttering sensation in my chest, and this carried on for months. And, initially I blamed the job. I wound up switching jobs, but it continued, and I was getting feeling sick from lack of sleep from the symptoms I was manifesting and calling out of work early and having my colleagues cover my patients. And it carried on so much so that I developed this intense shame and which progressed into a depression because I thought it was just that I couldn't live up to being a doctor. And I felt very embarrassed to be myself, really, and to be me. And, I shuttered away from my wife and my son. I was spending days in and out in my basement away from them because I was ashamed. I felt like I couldn't take care of my family. I felt like I failed the expectations of my entire life that I was going to be a doctor. But eventually I got the help that I needed. I saw my primary care doctor who started me on an antidepressant. I saw a psychologist every week, and I put in the work on me. I took time to take care of myself because I was taking care of others for so long. And eventually I did heal. and I found out a lot about myself during that time that I'm sure we'll speak about. But that's my journey, because now I've started sharing my story. I've written a book about it, and I'm able to reach others to try and end the stigma of mental health in medicine.
Yeah, well, thank you so much, because I say now almost every episode that every time a doctor shares their story, another doctor feels less alone. And it's so important. So I'm sorry that you went through all that, and I'm glad that you're in a better place now. And I'm grateful that you're using your voice to support your colleagues. It's really critical work. So thank you for doing that, Michael.
Yeah, no, definitely.
Yeah.
And I think it's important because there is a large stigma of mental health, just of mental health, especially in the medical community. But there is, and that's why I felt that shame that I mentioned, was because of the stigma, where I felt that I couldn't speak up about my mental illness and I couldn't get the help that I needed. I felt like it was a weakness, that it was I had to feel the shame to be me, because I felt, well, why is this even happening to me? And now I speak and tell everyone that we need to normalize that mental health and anxiety and depression or anything are, as being consequences of things we experience, such as myself experienced the loss that I experienced, is a normal part of the human experience, right? And this is part of being human. And doctors are just as much human as anyone else. And so, this is something that we need to seek to normalize in the medical community.
Right, exactly. And I do feel like more and more doctors are talking about it, and
Yeah.
hopefully we're making progress in that area. Tushar, what would you like us to know about you?
Yes, I think Michael set the stage pretty well for me to share what I'm about to share. So, being at Einstein, being in the grad school there while doing my thesis work, I also had a chance to teach in the medical school. And as I completed my graduate studies, and I got to see these students for those 4 years, progressing through medical school, and what the intense education system they go through does to them. And then as I completed my thesis, and I was also working in the lab doing preclinical research, which was going in to become clinical trials. So I got to see these students in their next stage of life, residency, fellowship, and having made friends with them while working with them, I got to understand their journey a little further. Yeah, it would seem to get more and more intense, more and more burdensome, and more burning out for them. And during this time, I also got to learn about the science of mindfulness, having practiced mindfulness myself for some years. But I became part of a study where they hooked me up with electrodes on my brain, like you see when they do brain research. Yeah. So the combination of looking through scientific research through the cancer lens, seeing the lives of doctors from medical school to fellowship and becoming attendings, and then the science of mindfulness. So some of the things we heard Michael share, the physical manifestations of stress, burnout, extremes levels of burnout, they are very connected to the experience of mindfulness. So I really got into it. And when I got to interact with cancer patients, yeah, and they said something to me that stuck with me forever. They said, "Thank you for bringing these new treatments through your research to the clinic that keeps us alive, but we would like to learn how to live." Yeah. And that kind
Mhm.
of came together for me through mindfulness, which has three elements to that: cognitive, thinking, speaking, reading, writing, watching, um, affective, the emotional aspect, and somatic. A lot of the things, as we understand, that are experienced by us, joy or sorrow or anything else, is experienced somatically in subtle ways or more extreme ways, like what Michael shared earlier. So I saw a clear connection. I really got into reading about a lot of research on it, became a subject of a study of this program called Mindfulness-Based Stress Reduction. And then I decided I'm going to bring these two worlds together. As my own medical students, they kind of motivated me to do so as I was sneakily teaching them meditation during respiratory systems. Yeah, and they said, "We know what you're doing. Why not be all out about it? This is very helpful." So that's where my journey began. I decided to bring this program to academic centers, to medical students, residents, fellows, and even other extreme work environments like educational program at Columbia University. And I see the outcomes of that, not only as research articles, clinical trials, but facilitating this with real people. I see their real stories that they share with me. So that's basically what I did do, and I'm inspired by, besides the hardcore preclinical cancer research, sequencing, and so on. Yeah.
Yeah, well, thank you, because that is also such critical work, and you're helping a lot of people by doing that, and it's so needed. So thank you very much for your efforts. Michael, what does that bring up for you? What Tushar was sharing?
I think that's amazing. Honestly, I think that these are the resources and knowledge that we need to share among medical education facilities, any type of high stress environment type professions, as you mentioned, hospitals, healthcare facilities, all of that. And that's why I think that, honestly, I think that addressing mental health is twofold. What you're addressing, which I think is amazing and completely critical, and I agree with you, Kim, is at the individual level, right? And I think mindfulness is so important for that. And I think that we need to be campaigning for mental health at all of these institutions so that all of the health workforce feel empowered to get the help that they need and provide them with these type of resources, that the type of things that you're doing. I think it's amazing, and provide them with that, and I think that's so important. And I think, though, there is a system level issue as well that's leading to burnout. So yes, I think we need to treat those with burnout and mental health with these wonderful resources, such as what you're doing, Tushar. I think is unbelievable. Um, and I think we need to provide those resources, but there is a system level issue that's leading to burnout, where physicians are basically, they've lost their autonomy and they've lost their ability to control their practices. And because of that, it's leading to very high stress levels, like you mentioned, seeing patients well above they would otherwise want to see in terms of numbers, and they're burning out. And that's another issue, that's a national issue that needs to be addressed at a much higher federal level. But I think that at the individual level, that's more immediate change we can do now. And I think that providing them with these resources, like what you're explaining to Shar, I think it's critical.
Well, actually, I would say it's even an international issue, right? Because I talk to doctors around the world, and some of them are facing the same struggles. And I just recorded an episode the other day with Dr. Gabe Charbonneau and Denise Weissman. And Gabe with Medicine Forward, and Denise Weissman is with Medicine Forward and the Healthcare Reinvention Collaborative. So I'm looking forward to publishing that, because we talk about creating deep networks, impact networks. And also Healthcare Reinvention Collaborative is looking to become like a network of networks, because there are things that are working. There are some great C-suite leaders here and there, right?
Yeah.
And that are doing things, and there are systems that are happy. And so we need to connect the things that are working. We need to connect, find out what's working and how we can replicate that. And our conversation, I thought, was, really exciting. So there is hope. And I like what you say, Michael, also about individual and the systems, because if people talk about, well, I don't need a coach or mindful because it's the system that's the problem. Well, yeah, there are issues with the system, and it's a yes and, because I just published an improv episode, right?
Mhm.
And that's all what improv is about, yes and. So yes, there are systems issues, and there are things that individuals can do to support their own well-being, and that they have to do if they're going to continue, right? So Tushar, what would you like to say?
Yeah, and you both bring up a very important point, particularly what I heard from Michael. Yeah, there is a systemic issue. And I see this not only in the medical education training and medical systems, but also the quote unquote high performing systems. Yeah, environments like corporate environment, and even Ivy League education systems. They follow the same trend and lead to similar outcomes of burnout. Yeah. So a thought came to my mind, that how about bringing more awareness, mindfulness to these policymakers in these organizations. So I did have a chance to interact with some of these leaders, departmental chairs or directors of places who make decisions. And one of them, this is rare, as like Michael said, it's a big issue. Yeah. But one of the directors of such a group she decided to bring mindfulness to her whole group because she saw how people are burning out in this very high performing environment. And this is rare for such leaders to consider this, yeah, to bring some change. So that was both at systemic level. She gave them some time. She made their life a little bit easier, less things to do. And then it also gave them a free science-based mindfulness program. I worked for them, yeah. So between changing the systemic level problems and then individual tools through mindfulness, this is the first time I saw that the people were like much less stressed, much more happier, and just with the fact that their leader cares about them. Yeah, that actually brought a big change in the way they felt. And the director told me the way they perform now, yeah, in the work environment. So that's what came to my mind when you both said that.
Yeah, well, and that's what's important is that leaders show that they care, that they do truly care, right? That's critical. And in the end, it helps their bottom line if they care, right? Because then they'll have greater engagement with their workforce, greater retention, and all of those things. And though that's exactly an example of what I was just talking about, right? And we want to know, well, how can that be replicated other places? Like, can she go to conferences and share that? And and now can you bring it to other institutions? What would you like to say, Michael?
Yeah, no, I completely agree. I love that you were doing that, Tushar, and I'd love to speak to similar leaders about that too. I think that's phenomenal. There is work being done. I'm not sure, for any of your viewers who may not know, there's the Dr. Lorna Breen Heroes Foundation. So Dr. Lorna Breen was the emergency medicine physician who unfortunately took her life in the height of COVID. And that the Dr. Lorna Breen Provider Protection Act is a great first step, that's going to award grants to hospitals and medical education institutions to campaign on mental health and provide resources to their facilities. I think that's phenomenal, and I can't wait for that to be enacted. And I think we need to continue similar work to address the system level. But I agree with you, Kayla. I agree with you, Tushar, that you can't ignore the self. I mean, I think that, there's no health without mental health. We have to take care of ourselves no matter what, because life, there will always be stresses, obviously at the professional level, but even in the personal level. So even if we address these system level issues, it doesn't mean that life's not going to throw us curveballs. So we still have to be equipped with the right tools to take care of ourselves no matter what.
Absolutely. And speaking to the Lorna Breen Foundation, that then knew Virginia was the first state to enact the safe haven right law, and then now Medicine Forward is working on Prescribe Hope, the audio documentary, and we're hoping to have that enforced in every state in the country as well. So it's safe for healthcare professionals to have no concerns about seeking support.
Definitely. Yeah. No, that's great things being done.
Tushar, I think you also wanted to speak a little about like the spiritual aspects and meaning and purpose and things like that.
Yeah, so mindfulness often is seen as something that people do when they retire or something that people do when they don't have much to do in life. Yeah, there's this taboo or this misinformation, misunderstanding about mindfulness. Very rarely are people aware that this is like a technique that has been researched for over 50 years now, existing much longer than that. Science is only a new lens to look at it. But they're like clinical trials in JAMA, yeah, about this, about how it reduces the stress and burnout in surgeons and how they make less medical mistakes. So less medical malpractice, less fines being incurred to the hospital and so on. So this is known, yeah. So the spiritual aspect, meaning, and so on, that is so connected to this. Once a person is able to be more in touch with themselves, understand their own emotions better, like having better mental health, like overall, then they are able to relate with others more. Yeah. If they have something that they find meaningful, it could be being a doctor, it could be something else on the side. Then they are able to have like this balance of energy, balance of intensity, and then balance of peace and calm that they get from whatever they do. Could be mindfulness, could be something else. But mindfulness allows them to get in touch with what those things are, what gives them meaning. Yeah. Like Viktor Frankl, the psychiatrist who survived the Holocaust, he says having meaning in life is very important, particularly if you give an example of, let's say, a patient we knew on our clinical trial. She was sent home that she might have like a couple of weeks, give or take, but she continued to live beyond 1 month, 1 year, 2 years. We don't know how long she's still living. And you know what happened to her? What changed? She had a granddaughter born, and then that was the meaning she found. Sounds very simple, but this could be being like a doctor running Cafe Foti, or being Kim Downey, helping people, helping physicians reduce burnout. So that meaning is what drives people, also improves their mental health, and overall keeps them happy. Yeah.
Yeah, that's
Wow.
beautiful. And so Michael, if you would like to piggyback on anything Tushar said, and also let's lead into Cafe Foti. So take it away.
Yeah, yeah. Well, I first want to comment on what Tushar said. That was truly beautiful. And I think that um that story you mentioned about that patient, it reminds me of my mom. There were two hospital stays. On the second hospital stays when she passed away. But after the first hospital stay, the couple days in between, I could see when I was speaking to her that she was really beaten down and lost a lot of her hope. She was never one to like seeing doctors or believe that she could be sick, and she, like all of us, feared death, and she was, 54 years old. And so I could see that this was really beating her up, this diagnosis. And I hadn't yet shared with her that my wife was pregnant with our first child. This would be her first grandchild. And when I did share with her, she immediately cried, but at the same time, I could see this newfound motivation in her. And I'll never forget what she said. She looked me right in the eyes and she said, "Mike, if there's a fight to fight, I'll fight it." And that was like her newfound motivation. Now, unfortunately, she did pass away not too long after that. But what you sharing that story about that patient reminded me of my mom, that if so be it, if she was able to get past that initial phase of how sick she was, I think she would have done the same thing. I think she would have to see her grandkids. So that reminded me of that. So I just wanted to comment on that. But yeah, so Cafe Fodia, if you can see it behind me here, my office is basically Cafe Fodia. I have the cafe sign over here. Uh, so the way that happened was, last semester I thought to myself, my students always come into my office, and whether it be career advice or advice on their classes or whatnot. And I thought to myself, if I could just create a safe haven for them, a space where they could just come and feel that they could just talk to me and relax, have a cup of coffee, because I'm a big coffee lover, and I have this coffee machine in my office. And I was like, if I could create that space, and I was like, what would I call it? And so I just told my name, Cafe Fodi, right? I was like, it's pretty easy. I was like, let me buy some snacks, so you can see I have some snacks here as well. And, free of charge, obviously. And I was like, come in, get, and made a little flyer, put it around all the flyers around our campus. And I gotta tell you, the students truly fell in love with it. They're always in here, and more than half the time, it's not even for coffee; it's just to hang out. But obviously, sometimes they'll grab coffee too, and it really just creates a safe space for them to decompress. And they're really grateful. So much so that around Christmas time, a group of our first year students got me this wonderful sign, that lights up, and it says Cafe Fodi. It's like made of metal. It's really, wonderful, and had it hung up. And yeah, so it's been truly a blessing. My students are so grateful and appreciative of what I do, and that's why I do it.
I love that, and I think that could be replicated other places. I wondered, Tushar, do you have any ideas?
Yeah, so when I was hearing this, there's so many things that came to my mind. The first one being how human beings they find the most joy in doing service, doing something for someone else, like what Michael had decided, that let me make this safe space for people who are suffering, maybe having a hard time. Yeah, finding joy in that. And then the other people, other person, seeing that and knowing that, this person has such great intentions, that he really cares about us. Like John Kabat-Zinn, the founder of Mindfulness-Based Stress Reduction, says, being able to connect and relate and seeing that care is where healing begins. And that's what I kind of see when I hear Michael talking about Cafe 40, about what possibly must be happening there. and seeing them happy makes him more happy. So it's kind of a
Mhm.
synergistic loop of getting better, feeling happier. Yeah. And then who knows, that might kind of exponentially increase. They will tell many other people about this. Who knows who will get motivated by that and open more cafes, like Cafe Fodi's. Yeah.
Yeah, I think we should start a revolution. There should be one like everywhere, right?
Mhm.
I've had people reach out to me, on the different podcasts I've been on, and they know about Cafe Foti before I've told them about it. So I don't know how that's happening, but
Oh.
yeah, it's definitely fantastic. And it's funny, since we last spoke, if you can see that picture right there, right next to Cafe Foti, my students invited me to another cafe, not my cafe, and threw me a surprise book release party for me.
Oh.
Yeah, at a different cafe. So it was very much appreciative. Yeah. Again, this is outside of what I need to do as a faculty member, but I come in early, I stay late, and that's because I'm here for my students. And I didn't have that, as a medical student, and it's such a simple thing just to be there for someone,
Mm,
provide an ear to listen. I know that obviously they can relate to me because I'm not too far out of medical school and residency, but also that I've just been through it. Whatever
mm.
years you're out of residency, at least they could speak to someone that's been through it and they can talk to them. And that's something for me that's so easy to provide, and at the same time such a good thing to provide for them. And I do it again because they're so grateful.
Well, and that can make all the difference. So yeah, thank you, Michael, for doing that. And Tushar, when we're talking about mindfulness, I believe there's probably some doctors who have still like never tried it at all, don't really know what it is, still might think it's a little, like woo, like some people use that word. What would you say to those doctors? Or something they could try
Ah,
as a
yes.
first step or
Yeah, this is a more common experience that I have than I would like. Yeah. But I like to say to them that imagine if you're measuring a heart rate of a person, yeah, and then you are showing them something really unpleasant or giving them a news they don't like, measure their heart rate again. Yeah. So we know that there is a direct connection on our cognitive perception of sensual hearing, and then what happens to us physiologically. Not to mention psychologically, they are super afraid. The fight or flight system is activated. Now, all those systems are known to be intimately connected with a lot of mindfulness practices. For example, there are many clinical trials on many different physiological aspects. But if I was talking about the heart rate or anxiety or depression, they had very good measurements of how that got significantly reduced with a mindfulness technique like mindfulness-based stress reduction. But here's what really struck me. As a cancer researcher, we are taking patient samples, cancer cells, and so on. And then we are doing a lot of sequencing, delineating these pathways involved in carcinogenesis in liquid tumors, leukemia, pancreatic cancer, several other cancers that I studied. Then when I studied the literature of mindfulness research, what genes it might be affecting, influencing when they take the DNA, RNA of, let's say, mindfulness practitioners,
Mm,
I saw there is so much overlap between the two, and that really startled me to say that these oncogenic pathways are getting dampened down or suppressed by something that might seem so simple, like sitting down and then focusing on your breath. Yeah.
mhm,
And then how that actually changes the connection between the logical prefrontal cortex we have, the logical or wizard brain, and then the reactive lizard brain, the limbic system, yeah, and
mhm,
how that leads to decision making, like how hard is making decisions in life, particularly for physicians,
mhm,
decisions about medical education, decision about patients, and so on. That becomes much more easier and manageable and less overwhelming, maybe not overwhelming, for physicians. And this has all been studied. They just need to read the literature. But more than that, it's so easy to be in the head so much like, okay, I'm going to read the data and then I'll
mhm,
believe it. But I like to say it's much more important to use that literature, information, cognitive information to build trust. But
mhm,
the important aspect of this lies in the experience. To really try it, for the prescribed length, 8 or 9 weeks, then see it for yourself. Whether someone took your blood and did all the tests on you, or whether you're checking your hormone levels and so on, cortisol, adrenaline, and so on, see how they change. Or if you check your immune system, there's so many ways to measure this, that this has been measured. So definitely looking at data and publications, research, clinical trials, but really trying it, giving it a chance by yourself and seeing it for yourself, because it's been done by many, including PTSD veterans who I had a chance to work with. Yeah, so that's what I will say. I would say much more, but
Yeah, no, thank
this
you.
would
I
be the
appreciate
start.
that. And during my own cancer treatments, I participated in a midweek mindfulness through our local cancer center on Zoom. And I used to clench my teeth all the time. And now I particularly like the breathing techniques and with a longer exhalation and inhalation. And that really makes a difference, especially like when I'm in an MRI machine or something like that, when I can like, count the numbers and count my breath. It's a lot better to have those techniques than before I know anything about them. So Michael, as we're winding down, if there's anything else that you wanted to share at all, either about what Tushar said, anything on your mind, or any top tips you have for colleagues from seasoned physicians to medical students, or even those considering med school.
Yes, yes. A quick comment on what Tushar said, and yeah, I'll definitely talk about that. You made me think about the quote, whether you think you can or whether you think you cannot, you're right. You know what I mean? How much the effect the brain has on how we feel and what we do, right? Mind, body, and
Mhm.
spirit. So that quote came to mind, which I think is a great quote. So, thank you for
Mhm.
sharing all that, Tushar. I bought into mindfulness long ago. So you sold me when I was already sold. So I just want to comment on that. Yeah, no, my advice I always tell all my students and everyone or anyone considering this field, is to be kind to yourself. This is something I always say because most, if not all, who go into this field are very much perfectionists. We feel that this is a high stakes profession. If we're not perfect, that's a patient's life. And I understand that, of course. But we're human beings. We are inherently not perfect, no matter how hard you try. But because of this perfectionist tendency, and our students tend to be harder on themselves than they need to be. And then this leads to stress. Stress leads to anxiety and depression. And that's what we're trying to prevent here. So I would say be kind to yourself. Understand that you have embarked on a really rewarding and noble journey. Pat yourself on the back for even getting where you are. Remind yourself of why you're doing this. You're there to help other people and to be there for them. But remember that we're not perfect. All we can do is our best, no matter what. And that's all we expect of you is to do your best. So just try to remember that, remind yourself of that, and to just be kind to yourself and take care of yourself.
I love that. Self-compassion is so important, and we're hearing that over and over again as well. So thank you for spotlighting that. And I know we're winding down too sharp. I don't know if you had a few sentences about like channeling faith in classical music or just anything you wanted to share as we close.
Yeah. So, it's very related to what Michael said, being kind to yourself, yeah. Believing in yourself and believing in something, whatever that might be, whether that's a medical profession, whether that is some sort of faith, spirituality, God, and whatnot. And really understanding yourself through that, yeah. And giving yourself grace, being compassionate to yourself, because once someone is able to be compassionate to themselves and kind, only then they can be to someone else. And it reminds me of this very simple quote by John Kabat-Zinn again, where he says, think about this. When you're breathing, there's more right with you than wrong with you. That's why we are breathing, yeah? So it has so many meanings for me, that simple quote. Yeah.
I love that. That's
Mhm.
fantastic.
Mhm.
Hmm. Yeah, wow, that's beautiful. And do either one of you have any suggestions for patients who wish to support their doctors?
Mm.
In terms of resources or just a recommendation?
Just a recommendation.
Please do. Uh, I think that's huge, coming from myself being a physician. Just remember that, we're doing our best and that there are plenty of resources out there to support physician wellness, many of which that you mentioned, Kim. I think, reaching out to those resources and you can read my book if you want to hear about what we went through during COVID and how it can affect us, and learn about kind of the depths of human grief, even what physicians deal with.
Thanks. Did you have anything to add to that, Tushar?
Yeah, certainly. Being able to communicate with the physician to really let them know what you're going through, to not shy away from speaking, and having some sort of practice, whether it's mindfulness or faith, that allows you to be yourself, be open. And a couple of authors, they come to my mind. If patients really want to know the journey of physicians and how they see patients, how they can better communicate with each other. So Siddhartha Mukherjee from Colombia and Atul Gawande in California, they have shared a lot of personal stories about patient-doctor interactions and how they both can support each other.
Oh, I think that's wonderful. Thank you.
Mhm.
So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors. And thank you both for being my guests.
Thanks, Kim.
Thank you, Kim, and thanks, Michael. It was a pleasure
Thank
being
you,
with
Tushar.
both here.
You're
Yeah,
welcome.
thank you.
And I'll include in the show notes ways that people, our listeners, can get in touch with you.
Excellent.
Okay.
Thank you.